Hi guys, and welcome to my third and final vlog where I'll be reflecting upon my coaching process and critically analyse my coaching behaviour and how it relates to the literature. So to give a brief description of the coaching process, Borey and Knowles define it as a series of stages that the coach has to go through to help with the athlete development and enhance a particular skill. This description can be characterised as the base of a layered model due to its vagueness, relating to the foundational component of the process. Nonetheless, there should be an awareness this is a basic requirement, but to be an effective coach, an extensive array of other variables need to be handled subsequently or prior to the session. The coaching process is a dynamic and multifaceted in nature, so this can barely touch the surface of underpinning the whole process. To elaborate on Borey's previous definition, Cushion et al. Developed the coaching process into 5 key features, which are displayed on the slide. Now, this offers a much more efficient way of highlighting the main themes to fundamentally improve as a coach, and combining these features cohesively, we can improve on aspects such as self-perception, awareness, and self-management. These conceptualizations build upon the previous description, moving up the layered model, and relate to the more advanced skills that are necessary to be aware of, having the ability to implement them effectively, and react appropriately when called upon in particular situations. So to provide some context, the athlete I'll be working with is a female adolescent academy footballer who is currently moving through the rehabilitation process after experiencing a patella dislocation during a game. Throughout the vlog, I'll be covering the topic of feedback, analysing external versus internal feedback, what feedback strategies are most effective considering the external constraints, and engaging in client feedback to therefore make the appropriate decisions to move forward in the session. Analysis will cover how I approached the session and what I could have improved on and what I implemented well. Lastly, I think it's important to allude to my coaching philosophy, so how I approach the session prior to delivering, and guidelines to help the session fluidity, considering the constraints of the athlete, understanding when it's appropriate to advance an exercise or to regress it. Also to be considerate of the feedback strategies that would best provoke a positive relationship to reach the end goal of returning her to sport. So in other words, feedback considerations when working with the youth population, awareness of injury status and development of her rehabilitation. So to begin analysing my coaching process, initially I provided an overview of the session design where I planned for the athlete to move through a series of hopping progressions. Finding an approach that was appropriate considering the external constraints was important to aid rehab development. So when demonstrating the exercises in the session, the use of external and internal feedback was utilised. Now I switched between both forms of feedback during the session inadvertently. My focus was to provide an external emphasis on the feedback that I used because I wanted to facilitate the motor learning process more effectively, encouraging autonomy during the progressive drills. The athlete was familiar with the movements being shown as it is frequently performed in our sport, so I wanted to use external feedback to allow for flow and simplicity in the motor learning process, which would be significant for her development. And by using both, this could potentially cause overcomplication for the athletes, focusing on their own body and the environment during the task. So to provide some context for the example phrases that I use for external feedback, I use phrases such as push off the floor and maintain balance by stabilising after each hop. And internal feedback examples were drive toes into the ground and land on balls of feet, and straighten the knee to reach higher. Now, sometimes I think it's appropriate to switch between the types of feedback, as we could drive an improved response with the athlete. It really does depend on the individual and the situation at hand, and perhaps internal and external cues are appropriate at different stages of the rehabilitation process. And manipulating the focus of attention may allow athletes to discover the movements themselves, allowing to sufficiently self-organise the kinetic chain. A study by Louse and Sherwood illustrates that external feedback can deliver a more effective approach in contrast to internal feedback due to the increased co-contraction of agonist and antagonist muscles, which may result in limiting the variability of movement and allowing for unnecessary recruitment of muscle units within the muscle groups, which can therefore interfere with the arrangement of the motor system. So in other words, there is less efficiency and variability present with an internal focus. The second study explored external versus internal feedback during a jump and reach test, with external focus coming out on top with a group of athletes, as neuromuscular activity was improved compared with the other conditions. It is also important to note, though, that there was a low participant group within the study, so that should be carefully considered. However, the final study actually supports internal feedback, where they have demonstrated to efficiently target biomechanical issues associated with increases in the likelihood of ACL injuries in female athletes. Although this is not the injury that the athlete has sustained, the knee dysfunction is still relative to female athletes. So gathering the information from the research, there's arguments in both corners, but it seems from the literature an internally directed focus may have been used in the past, but may not be adequate enough for acquiring control of complex motor abilities required for sport reintegration. Whereas the external focus of attention may lead to more successful performance outcomes in rehabilitation, as this could transfer effectively to competitive sports. But as previously mentioned, it depends on the environmental constraints exposed to us when we are coaching. This aspect of my coaching did not affect the outcome of the session, demonstrating a concise feedback protocol may have improved my own communicational skills with the youth athlete. And considering the constraints of her injury, in reflection, the approach was an effective one, as the athlete progressed competently throughout the session and managed well for my first time using jumping movements. So now looking at the second part of this vlog, where I'll be analysing my own feedback strategies and looking at client feedback. So we then moved on to some lower extremity strength work, focusing on building robustness and resilience around the knee to facilitate the rehabilitation process and lower the risk of injury reoccurrence. So it was important for me to ascertain the most effective feedback strategies to gain a positive result, considering the constraints of the athlete. So to allude to how I approached the session, it's necessary to provide an overview of the types of feedback that I applied. Augmented feedback should firstly be highlighted and can be viewed as information about the performance complementing sensory feedback from an external source, with this being beneficial to increasing athlete confidence and enhancing their skill acquisition. Now, there are two types of augmented feedback. Only one, which I'll discuss, which is knowledge of results, and to further narrow down the strategies I use within KR are depicted on the slide. So we have summary and average KR, which delays and summarises the performance after various sets, and KR estimation, which asks and questions the athlete to get an understanding on how they performed and how they felt after performing the movements. So a summary KR strategy was used with the athlete, as this was shown to be an effective approach for long-term motor learning. Providing a reduced frequency of feedback at the end of each set or couple of sets, this can be associated with an improvement in cognitive effort. As we were moving through some simple skills ranging from the hops into the strength work, I would allow for some variability of the movement, ensuring it was executed in a safe manner, relating back to the external focus of attention, exploiting an intrinsic way of learning to become less reliant on excessive information from myself. This in turn will lead to a mobilization of their cognitive processes for detecting poor performance markers when receiving less augmented feedback, which was found to be effective for the ages between 9 and 17. Now, KR estimation was used to allow for athlete participation to promote self-confidence, expedite the learning process, and to provide feedback on her injury. We used a 1 to 10 pain scale to grasp a rough approximation of the pain experience after exercise to ensure progression was safe. The pain scale referred to 1 feeling no pain and then 10 feeling sort of maximal pain, which we specified 6 is a number that we want to sit below. And just to note that we never exceeded a pain scale of 2. Setting realistic performance expectations and recognising improvements through KR estimation was significant in aiding her progression, or developing a relationship for the athlete to buy into the work that was required. Black and Weiss found that greater encouragement, corrective cueing and lower disapproval succeeding poor performance was related to higher competency in 15 to 18-year-olds. However, Allen and Howe established the opposite, finding lower competencies associated with these variables. So looking at both of these studies and during my process, I felt it was appropriate to engage in frequent encouragement when executing movements well, or and maybe not so well, just being considerate of her situation. and providing this to enhance their incentive and motivation, attempting to reduce the psychological factors associated during the rehabilitation process. To conclude, I perceived a strong social support and encouragement was necessary, with positive psychological responses promoting a greater likelihood of the athlete returns to their pre-injury level of participation and returns to their sport more quickly, so finding the appropriate feedback strategies was my essential motivation. Flip side, sometimes I'll provide too much information and perhaps condensing my feedback messages to make it simpler for the athlete could have offered a more concise approach. An excessive amount of feedback can be detrimental to the learning process since athletes will find it easier to take on 1 to 3 points between sets.